Um, this video is a follow-up on the death of Dr. Janelle Green Smith. Apparently, she died from complications of preeclampsia. She was taken for an emergency, a C-section, and her abdominal wound ruptured later on, which, as nurses, we know opens the door to infection and all sorts of other complications. Um, I have very little education about that, but in the last few years being an ICU nurse, they have started incorporating the treatment of patients that suffer from pre-eclampsia and would end up in the intensive care. And we know that the most dangerous period for a woman is in the post-operative period, in the perinatal to postnatal period, because of the likelihood of developing preeclampsia and all sorts of things. And this, in her case, I think the fact that she was a midwife makes it so much sadder, because and she was also an advocate for women, for pregnant women, or and she always looked out for them, but she had nobody that was looking out for her. I mean, I'm sitting here at 2020, um, with 2020, I hindsight, but I remember the classes that I took, and it was incorporated in the ICU, was dealing with the medications, or the replacement of medication, and the giving of magnesium and things to help with seizures and all sorts of things. But also one important factor was if the patient had a cesarean section, that we should watch for, for bleeding, not only vaginal, but also intra-abdominal bleeding, palpate the abdomen and things like that. So somebody somewhere, in my opinion, dropped the ball. And it's very, very sad that this happened to her. And I just once again want to convey my deepest sympathy to her family, her husband and her daughter, as well as her mom and everybody else.